Redditors who have been in such severe and enduring physical pain that they honestly would have clicked an insta-death button. What was the cause of your pain? A bone tumor tearing apart my shoulder. It was inside the joint. So any movement of any sort would cause the tumor to rub against the muscle, causing damage. Migraines. I've read stories of people boring holes in their heads for relief. And I understand why. I've luckily only had one migraine ever. I ended up in the ER after vomiting all afternoon and through the night. I remember just wanting to pop my eyes out with spoons to relieve the intense pressure pain. The ER docs gave me something through an IV that made me freezing cold and tired. I fell asleep, and when I woke up I felt 1,000,000 times better. I would never wish that on anyone. Thank goodness for medical science. I got that shot. I was super cold, like my bones were dipped in ice. I didn't get tired. I got wired and paranoid and twitchy. Also my head still hurt. Didn't touch the pain. Took me a couple days to feel better. The migraine didn't go away. And the meds made me feel shitty too. I only went to the ER cause my husband thought I was having a stroke. Nope. Just a migraine. Migraines suck so hard. I'm glad you've only had one. And I hope you never have another. Side effects of chemotherapy. An acute infection and diarrhea. Had the worst pain while moving, sitting, lying down, not to mention actually using my butt I ever experienced. Took heavy painkillers but the pain didn't go away. Thought it would never be over. 10 days of pure hell. To clarify, when you get certain types of chemo your mucous membranes can get inflamed. This is pretty common. I didn't know you had them down there too. I was in hospital because I caught the flu while having a non-existent immune system. The diarrhea hell went on for like 10 days. And about 5 more with were endurable. Chemotherapy and radiation therapy took in total about 5 months. If you notice anything weird with your body, get it checked. If you are suddenly unable to drink alcohol without massive pain, have swollen lymph nodes, trouble to breath, are easily out of breath, or are losing a lot of weight for no reason in a short amount of time, please go check it out. It can be something serious. Morbus Hodgkin's lymphoma is 100% deadly if left untreated but has a approximately 90% survival rate if you get chemo. When my appendix went on me, I remember thinking it was awfully strange that the pain from surgery was pretty okay compared to what I went in for. I had a similar experience with my gallbladder. Like an idiot, I waited way too long to actually go see a doctor. By time I did, I was in so much pain that I was begging for surgery or death. After they removed it, I was up walking after the anesthesia wore off and never took a single painkiller. I was so relieved to have it out that I didn't even notice any post-op pain. I had a tooth infection that made me want to end it all. I didn't realize how horrible it could feel. Thank goodness for modern dentistry and antibiotics. Antibiotics didn't alleviate mine, nor painkillers. It took an emergency root canal to take care of that pain. Worst thing I've ever felt. Also, one dentist told me to cool it down with ice water. I ended up freezing the nerve, then had to allow it to thaw. That was pain unimaginable. My foot was cut off and reattached. There were so many times that I just wanted to die. The pain of that is almost unspeakable. I had a buddy that got ran over by a boat. Mangled his leg, but they were able to save it. He's been talking for years about having it removed because of the pain. Dry socket. In 2 spots. At the same time. I've had 4 children. CSEC and vaginal. Broken bones. Ruptured ovarian cyst. Nothing compares to dry socket. Had that. It was painful. But the scraping of the bone the doctor did, even with the local anesthesia, was the pain I will never forget. I had an abscess in 2 of my teeth at the same time. While we're on a farm in the middle of nowhere for a weekend away. I then also took too many paracetamol to try and stop the pain. Which made it feel like my blood was boiling. 0 tenths would not recommend. I've broke both my feet. Have ulcerative colitis and rheumatoid arthritis. And have been stabbed 6 times in the back. Put all of that pain together and it still doesn't come close to when I broke a tooth and got an abscess in it. One day while eating, my tooth just fell apart due to my wisdom tooth growing into it and cracking it. Because of my medical conditions I'm on immunosuppressants and there's only a 1-week window every 8 weeks I can have dental surgery. I needed the tooth removing and the day came but they cancelled. I had to wait another 8 weeks with an exposed tooth and during that time it got infected. I can't take anti-inflammatories and before long my whole face was swollen up but I still had a week to wait. It was so painful and just consumed my life. It's all I could think about and it was constant. I'd rather get stabbed again than go through that again. Walking up after brain surgery was pretty fucking awful. I had an 11/10 headache. I felt like I'd just been hit by a truck. And they had a hard time stabilizing me. I felt like I was freezing to death and my blood pressure was low. Then I felt like I was on fire and my blood pressure went to normal and this repeated in what felt like 10-minute cycles for what felt like days but was more likely a few hours. I threw up about a liter of blood and other fluid. I felt incredibly weak despite being relatively strong-ish. Nothing I did helped me feel better. And it wasn't really the pain so much as how uncomfortable I felt. I have a fairly high pain tolerance. But I have a really low uncomfortable tolerance. I would have absolutely chosen death at that moment without question. I'm glad I didn't have that option though. Because being alive is alright. It was all because of a pituitary tumor that caused me to be a giant. But I'm only 7 feet tall. I'm a shitty giant. TLDR, had a pituitary tumor removed. It was less that awesome. Crohn's disease. Had it for 10 years now and they have been 10 pain-filled years at that. When I was diagnosed I'd lost nearly half my weight in a couple weeks and was in so much pain daily. Took years to get to a point where I could look ahead with any sort of hope. Warning, graphic. When I was 11 I got an infection in my penis. Turns out the foreskin is supposed to be able to be pulled back. Which mine physically couldn't, so I got circumcised. Bear in mind my foreskin had never been pulled back so what is arguably the most sensitive part of the male anatomy was now permanently exposed for the first time. When I slept my entire belland would scab over including the hole and every morning for around 2 weeks when I went to urinate my penis would begin to inflate. Cracking the scabs until the scab on the end eventually burst open. I warned you. Double lung collapse combined with a double kidney infection. I've given birth 3 times and that was a walk in the park by comparison. I could feel myself dying. Spoiler, I didn't. There's something known as a chemical cardioversion. If your heart has an abnormal rhythm, one of the ways it can be reset is by administering drugs such as adenosine. Long story short, adenosine will stop the heart very briefly and then once the drug breaks down your heart restarts. Hopefully with the correct rhythm. One of the side effects of this is a feeling of impending doom. The body feels the heart stop and the way that is processed in our heads isn't, hey buddy, your heart stopped. It's processed as, oh shit, oh shit, oh shit, you're dying. Which is apparently pretty unpleasant. Migraines. Had a period of about 3 years where I'd get one that completely knocks me on my ass for 2 to 4 days at a time. I missed a lot of work. Tried tons of medications. Got CT scans. Nothing fixed it until I moved out of my mom's house. Haven't had a single one since that day. Somehow. Thanks, Mom. A colony of ants biting my testicles when asleep. Woke up to a set of gigantic balls. And I'm assuming sweet too. Anal fissure. Which is a tear in the meat of your anus. Sometimes it heals on its own. Sometimes you end up like me and injure yourself every time you use the bathroom. I have dislocated a knee, broken fingers, had an appendicitis, and got a chemical burn on my scalp but nothing compares to passing out on the toilet. And while I have you, let me just say, use lube. Saliva is not lube and don't allow your partner to ram it in like a stewardess trying to get your oversized luggage to fit into the storage compartment. I don't care how amorous you're feeling, stop, think, and protect the butthole. Scrolled too long to find anal fissure. As a colorectal surgeon my fissure patients are among the most distressed of my patients when I first meet them and the happiest and most grateful of patients when they are fixed. PSA everybody. Keep up your daily fluid and fiber intake and always go for a poo when you feel the urge. These things will help you out for more things than fissures. Kidney infection that nearly turned into sepsis. When I was 14, I spent a week on the couch in agony. My dad told me it was food poisoning for the first 2 days. And the flu after that. I mentioned kidney pains. He told me it was because I was vomiting everything back up. His fiancée came home from an out-of-state work conference on day 8 of my flu. That night I woke up thinking I had been stabbed in the back. I was screaming so bad that my dad said I was faking it, but his fiancée said he had to take me to the ER because I didn't look right. They ran a urine test. A few blood tests even checked my vomit to make sure I hadn't taken drugs, at my dad's request. 2 hours later I was being admitted for sepsis symptoms and given more antibiotics than I can remember. They said if we would have waited until morning to see the doctor or not gone at all I could be dead. Oh, and I also have juvenile diabetes. I moved in with my mom a few weeks later. I sometimes feel some pain under belly button and deeper in. Feels like my guts are twisting inside and tearing apart. Like black hole sucking in my intestines. If I would live alone, I would scream as loud as I could. But I always bite a stick or handle of knife and silently snort. Sitting on knees and beating my shins, I do it to redirect the pain. To change the focus of mind to shin. Just weathering the storm. It comes about once in month. So I can say I visit hell regularly. Gallstones, which had been misdiagnosed for years. By the time I had my gallbladder removed, a flare-up would have me literally rolling around on the floor in agony. Apparently they're the closest a bloke can come to experiencing the pain of birth, but I've no idea how that's quantified. I had a ruptured disc that horseshoed itself around my sciatic nerve. I tried to act tough and just walk it off, but the burning sensation and constant spasms in my leg 24 hours a day made me want to die. Eventually, after 2 trips and still acting like I could handle it, I was given high-strength steroids and Norco to tide me over till I got an injection in my spine before eventually getting surgery to cut away the ruptured disc. Nothing has ever hurt as bad as those first 2 weeks without pain meds. Even after the meds and injections, it was just enough that I could stand the constant discomfort. I highly recommend people take better care of their backs and seek medical attention as soon as possible instead of holding out for it to go away like I did. Wisdom teeth. Had to get them removed because the roots were touching the nerves in my jaw. Super painful for 4 years until I finally gave in and got them removed. Couldn't eat without wanting to cry. 12 hours after C-section when I wake up and had to pee and morphine worn off. I had to stand, do a couple steps to bathroom, sit on toilet, bend to put pants on because I'm idiot and forgot to keep them high, and go back to bed to lay. I almost threw up from pain. Nothing ever hurt that much. Food poisoning. I woke up from a dead sleep at 3 a.m. with what felt like a knife in my gut and then spent the next 4 hours on the toilet wishing for death. Just for some reference, I've had an emergency C-section. A C-section wound infection that was cleaned in office with no painkillers. An adult tonsillectomy. A hysterectomy following years of endometriosis and adenomyosis. 4 wisdom teeth removed at once. And migraines. And none of them touched having both ears being manually cleaned out by an ent at age 7 during a total infection resulting from untreated swimmer's ear. My mom said he just kept scooping brown goop out of my ears as 4 nurses held me down. It was horrific. When I was 10 years old, auto car run over my leg, specially on my big toe. Complete nail come off. I was able to see my skin under that, and bleeding and pain was too immense for 10-year-old me. Not me. But I've dealt with patients who have trigeminal neuralgia. I'm pretty sure they'd gladly hit that button. I went septic from a misdiagnosed kidney infection and my body was starting to shut down. The pain is still indescribable when I talk about it. Wouldn't wish that upon my worst enemy. I think there were 2 occasions for me. One was swimmer's ear, my ear swelled shut and the side of my head was swelling. The other was a migraine that felt like my skull was splitting open and an eagle was giving my brain a scratch. My first kidney stone, I had no clue what was going on. Either my kidney or appendix or something had exploded and I was slowly and painfully dying. Have you ever vomited just from pain? You keep retching even though there is nothing left in your entire system. I absolutely would have taken a quick and painless death over what I thought was a long and excruciating one. Food poisoning. I was literally on the floor, screaming and writhing in pain. Boyfriend called 911 because we didn't know what it was. While he was on the phone, I puked everywhere and it was a long night of stuff coming out of both ends. A long night. Dry socket after a bone graft. The pain was endless and unrelenting. I walked around the house pacing and howling in pain for days. Lost a ton of weight from not being able to eat for almost a month. I'm about to give birth any day now and I'm imagining it still won't be as painful as that was. Giving birth. I have very low tolerance for pain and epidural wasn't effective. Everything was supposed to be ready for the pushing and the baby really wanted out. Then my previously fully dilated cervix decided that there is still time to go back,